Okay guys, back here, second half of the week. So this part is going to have more to do with the appendicular skeleton. So it comes from the word appendage, or extension from the middle, is what we're going to talk about. So I'm just going to work top down. May spend a few seconds talking about some common injury issues that occur, especially within regards to weights and how we use our bodies, and maybe just some things that you can watch out for when you're doing a workout on your own. So I'm going to blow this up just a little bit so we can see a little bit better. So there we go. So starting at the top, just clavicle. This is a pretty common injury in sports, specifically, even football probably sees this a lot just simply because of the crashing and the amount of weight going down. So clavicle's right here. This connects all from your rib cage or your sternum over into your humerus, that humeral joint over here. So clavicle is here. And then we go down to, on the back is your scapula. I'll need to go back to a different view here, different screen. So your scapula right here, and this is one where I'll pause just real quick. One of the things that's kind of a pet peeve of mine, you'll probably hear when we do shoulder raises, specifically moving anteriorly or to the front, when you do a shoulder raise that goes like this, that scapula needs to be depressed. In other words, if you can take your shoulders and hike your shoulders up and then round them back and push your scapula down, that is the position that your scapula needs to be in order to protect that shoulder joint. There's a lot of connective tissue. Your rotator cuff, which is comprised of some other muscles up there, can really get damaged if you're lifting too heavy a weight and your shoulders jetted forward as you're doing that. So make sure anytime you're doing shoulder raises that your shoulders are up, rounded back as you're doing that. All right, so far we have the clavicle and scapula back here. You can actually see that triangular bone there right behind the rib cage. And then we'll work down the arm here. So I have the humerus, which is probably where we get the name funny bone from, that ulnar nerve that comes down and kind of can, you ever hit your elbow on the chair, it doesn't feel very good. So you have the humerus bone, which is probably the second most difficult bone in your body to break, just simply because of the amount of muscle that surrounds it. And then extending down past the elbow, we have the radius, which a good way to remember is in alphabetical order. So if you have, try to get the camera view here, if you have your thumb up, okay, this is your radius, and underneath is your ulna. So it's in alphabetical order. So you have the radius here, and then the ulna out here on the outside. And then from there, you can see all these little tiny bones. Those make up your carpals. That's your wrist area. And then you have the metacarpals, which are the first set of bones, which essentially actually is your hand. So your phalanges are the extent beyond here. So this is your phalange, and then your carpals are actually from here to here, and then this is, carpals, metacarpals, phalanges. So that's how that is, and you can actually see the numbers out here on this little chart that we have to describe that. All right, so then going back, and we'll jump over to the pelvis, and I'm not going to break this up into all these little bones that make up the pelvic girdle. We're just going to call this the pelvis, just that heart-shaped muscle that connects your lower half of your body to your vertebrae. So that's just your pelvis. And then working down, we have your femur, which is probably the most difficult bone in your body to break. The quadriceps and hamstring complex are very, very thick. It's a difficult bone to break. It is possible, but it's usually some pretty severe trauma that creates that. So this is your femur. And then right here, this little circular bone right here on top of that head is the patella. And then below that, the big bone, this is the one that if you've ever kicked a little chair or run your knee into something, or your lower leg, this is your tibia. That's the bony part on the front of your leg. Out here to the side, this real small one is your fibula. And then the feet kind of are very similar to the hands in that we have tarsals right here. So just like up here we had carpals, these are tarsals. And then what makes up that main part of your foot is a metatarsal, and then the toes are called phalanges again. So you can always go back and review that if you have any questions or ask me. But that essentially is the appendicular skeleton.